All right, let's get right into it. We all have vivid memories of 2020, right? The overwhelmed hospitals, that feeling that the whole system was just moments from collapse. But what if the next global health crisis could be completely different? What if a new wave of technology could come together to build a health system that doesn't just react, but actually predicts, adapts, and secures itself? Well, that's the future we're going to unpack right now. This quote from the source material really hits the nail on the head. It reframes the whole problem for us. When we think back on all that chaos, we tend to see it as a purely medical crisis. But the deeper issue, the thing that really caused everything to grind to a halt, it wasn't just a lack of beds or ventilators. No, it was a failure of information.
So, before we can even talk about the amazing solutions, we have to understand what actually broke. What was it about our system's backbone that made it so fragile? Yeah, behind the scenes of what we saw in the news, there was this whole other crisis playing out. Imagine this. Hospital A literally couldn't share critical patient data with Hospital B because their computer systems didn't speak the same language. You had vital information being sent over insecure channels, totally vulnerable to attack. And then, when disaster really struck, the very communication lines needed to coordinate everything, they just fell apart. That was the real failure.
And this right here is the core lesson. In the 21st century, modern healthcare isn't just about doctors and medicine. It runs on a constant, secure, and seamless flow of data. So when that informational backbone turned out to be brittle, the entire system just fractured. The big takeaway is clear. If we want to build a truly resilient future, we've got to start by reinforcing that digital core.
Okay, but this is where the story gets really hopeful. There's a convergence of three very specific technologies happening as we speak that promises to forge a completely new backbone, one that's not just stronger, but a whole lot smarter. First up, security. Patient data is some of the most sensitive information out there, but our current encryption methods have their weak spots. Well, quantum key distribution, or QKD, is a total game changer. It basically uses the fundamental laws of physics to create encryption keys that are, in theory, unhackable. And the massive breakthrough? We can now actually run this technology over existing commercial fiber optic networks. This isn't just a lab experiment anymore. Next up, prediction. Instead of just reacting when a crisis hits, what if we could see it coming? That's the whole idea behind urban digital twins. Think of them as AI-powered virtual copies of our cities, constantly fed with real-time data. It's like a simulator for public health. For a real-world example, just look at Singapore. They're already using a digital twin to predict dengue fever outbreaks, so they can get control measures in place before things get out of hand.
And finally, adaptation. We all know that during a disaster, communication networks often go down. Well, integrated sensing and communication, ISAC for short, is all about redesigning these networks to be smarter. They don't just transmit data anymore, they also sense their environment. An ISAC network could be routing emergency calls while at the same time mapping which roads are clear for an ambulance. It's like giving a city a true resilient nervous system, one that can feel and react to a crisis in real time. But the real magic isn't in any single one of these. It's how they all work together. So picture this. In the next crisis, the digital twin predicts a massive surge of patients heading for specific hospitals. Health officials can then use those quantum-secured networks to safely transfer patient records and redirect people to other facilities that have capacity. And at the exact same time, the ISAC system is managing the chaos on the ground, making sure ambulances have the fastest, clearest routes. That's convergence in action. But, and you knew there had to be a but, this powerful future isn't automatically going to be a good one. With all of this incredible promise comes some pretty significant peril that we absolutely have to deal with. So let's look at the first major hurdle. The promise of quantum security is amazing, right? Perfectly protected health data. But the peril is what's being called a new quantum divide. What happens if only wealthy nations can afford this level of security? Well, it would create a world where the health data of the most vulnerable people is also the most exposed, making global inequality way, way worse. And what about those predictive digital twins? Again, the promise is obvious. We can get ahead of a crisis. The peril, though? If those AI models are trained on biased data that underrepresents certain communities, they won't just be a little bit inaccurate. No, they will actively harm those populations by literally making them invisible to the system and steering resources away from the very places they're needed most. So the big question is, how do we get the promise without the peril? Well, the good news is there is a path forward. but it's going to require some very conscious, very deliberate choices. And we need to start making them right now.
This right here might be the single most important takeaway from all of this. The technology itself, it's just a tool. It's neutral. Whether it leads us to a more equitable and resilient future or a more divided one comes down entirely to the choices we make and the rules we put in place starting today. So what do? Our source material lays out a really clear roadmap with 4 main priorities. First, the health community needs to get in there and define exactly what these systems need to do for them. Second, we have to champion funding models that make sure every country gets access. Third, we need to establish non-negotiable ethical guardrails around data and algorithms. And finally, we have to build a new generation of experts who get both public health and technology. This final quote just captures the entire point perfectly. The incredible benefits of all this tech converging, they aren't just going to happen automatically. It all hinges on the deliberate, the equitable, and the ethical work of governance that we have to start building today. So we're left with this final question. The tools to build a truly resilient global health system are arriving. The technology is making it possible. But the real challenge, it turns out, isn't technical at all. It's human. Are we wise enough and are we truly committed enough to make sure we build that future not just for some of us, but for everyone?